discuss about the basic care of newborn. It is the part 2. Yesterday we discussed the part 1 in this. So in the basic care you will find that 90% of the newborns, they don't require much intervention. They start their first breath immediately, and they are vigorous, crying, and postnatally not much intervention is needed. So if the amniotic fluid is clear, there are no risk factors in the child. They require only routine care. What is the routine care? Points you can note down. First is that you have to maintain the temperature of the child. Proper positioning of the child. Cleaning and patency of airways. These are the three things which are usually needed: temperature maintenance, proper positioning, and cleaning of and patency of airways, so that the child can breathe properly. For proper positioning, a roll of towel, just a small towel, that can be placed under the shoulders of the child, so that the neck is slightly extended. It is not like this. It should be slightly extended, so that these airways, they are open. Secondly, you have to take care of 5 C's. What is the 5 C? That is the clean hand. The person who is doing the delivery, conducting the delivery, the hand should be clean. He or she should be wearing the sterile gloves. Then after delivery, the child is to be placed on some surface. It should also be clean. Third is that the scissor or blade with which you will cut it, it should be clean, not a used one. Thirdly, the cord tie. These days it is the umbilical catheter which is used. Cord tie is rarely used. Where it is not available, it should also be clean. And thirdly, the cord stump. You understand what is stump? One, after cutting the cord, the remaining portion which remains attached to the body of the child, that is called umbilical cord stump. It should also be left as such. No material should be applied on it. So these are the 5 C's that you need to take care of. Some of the children, they may need assistance in breathing. They may need mild tactile stimulation, touch stimulation, and this touch stimulation is usually automatically provided when you clean the baby. You dry the baby, clean the baby, automatically touch is provided. Secondly, when you do the oral suctioning to clear the airways of the child, then also a stimulation is given to the child automatically, which helps in start of the breathing. So if these two processes, they are not sufficient, then you can do mild rubbing on the back of the child. जो back है उसके ऊपर आप mild, you can do the mild rubbing, and you can also do flicking on the, ऐसे करके flicking on the sole of the newborn. But this flicking and rubbing should not be too vigorous and should be attempted only for 3-4 times. Meanwhile, usually the breathing starts, and if in any case the breathing doesn't start, then you will need to resort to the resuscitation measures that we will discuss in the next chapter. Now, provision of BAMS. Why it is important? Because as we discussed, when the child is born, it is all wet. So, the wet body loses the heat very rapidly. If there is a winter or some fan is on, air currents are there in the labor room, then evaporation takes place and child may go into hypothermia. So what is important? That the delivery room should be warm, it should not be cold. There are no fans running in the delivery room where the delivery is taking place. Open windows through which air currents may come should also be closed. As I have tried to show in this diagram, let us say this is the door, this is the window, this is also the window. So here the delivery table is there. So air current will go from here, here, and it will make the delivery room cold, and child may also go into hypothermia. This you need to take care. Secondly, the body should be dried effectively and covered with a dry, clean linen sheet. If one sheet becomes wet, you remove it, discard it, and you take another dry sheet. Baby is preferably placed under the servo-controlled valve. If it is not available, then it can be placed under the heater also, or you can place him under the 200-watt bulb also. If the heater you are using, it is not servo-controlled, then you need to be very careful, because too much heat from the heater that can also cause injury, heat injury to the child. So in the servo-controlled warmers, the temperature is set at a particular degree and it shuts off when that temperature is reached, right? Or baby can also be ideally placed on the abdomen of the mother also, immediately after birth. That will help in keeping the temperature of the baby normal, because the heat from the mother will be transmitted by direct skin contact to the child, and moreover it will also help in initiating the early breastfeeding also. So this is what is the name of this, where you place directly on the abdomen of the child. What is that name for this technique? Anyone? It is called kangaroo mother care, KMC, kangaroo mother care. After drying, the wet clothes should always be removed. This is very important. If the child remains in the wet sheet, it will make the child cold. Now we talk some of the points regarding the warm change. So, if hypothermia takes place, it is a precursor for many diseases. This is very important, that is why you need to be very careful. The 10 steps in the warm chain, they are: first is warm delivery room. Then resuscitation should also be at the resuscitation table, it should be warm environment. Third is immediate drying. Third is immediate drying. Fourth is skin to skin contact with the mother. Fifth is early breastfeeding. This also helps in restoring the temperature. Postpone the bathing. What does this mean? In some, what the dyes or untrained birth attendants they do, they give bath to the child immediately after delivery. This is wrong. It should not be done. Then appropriate clothing, especially in the winter and also in summer. The child should not be kept naked. Appropriate clothing depending on the environment should be put on. Usually, if you are wearing two clothes, the child will need one extra cloth. 3 layers of clothes will be needed for the child. Mother and baby together. If the child is to be put on the bed, it should be adjacent to the mother. Otherwise, what happens sometimes, the attendants, they take hold of the child and go in the corridors or outside, and this unnecessarily leads to not only hypothermia but chances of infection, they also arise. Professional alertness. What does this mean? That if you are aware of these points, you will immediately stop any of the wrong practice. And 10th is, if you have to transport the child, warm transportation, then also you will need to take care that the child remains warm. So, now we come to the next, that is what is cord care. How to provide the cord care. The cord is clamped when child is delivered completely and stabilized. It should be done in a relaxed manner, not in a hurried manner. These days the practice of cord clamping is a delayed cord clamping. Delayed cord clamping means 1 to 2 minutes after delivery. But it will improve the, you can note down, one is hematological status of the child. The iron load in the newborn will improve. Iron load of the newborn will improve, and the chances of physiological anemia, which takes place at 2 to 6 months of age, will also, the chances will decrease. So just 2 to 3 months delayed cord clamping will help in these ways. In the preterm babies, it will further help in reducing the intraventricular hemorrhage and other morbidities. But are there any conditions where early cord clamping can be attempted? This you should also be aware, where we cannot postpone the cord clamping. One is if there is a severe birth asphyxia, then you should not delay cord clamping, because you will need to resort to resuscitation measures, and you will need to cut the cord. Second is if there is a cord around the neck. Sometimes you will be discussed cord around the neck chapter, new chapter, and or if there is chances of RH isoimmunization, RH incompatibility. And under these conditions, you should not delay the cord clamping. But one point is that you should not attempt the cord milking. What does this mean? Cord milking means that you take the cord and start pushing the blood toward the child by milking it, by pressing the cord. This should not be. Automatically, when the cord is not cut, the blood from the cord will flow to the child. You need not milk it towards the child's body. It can cause many problems if this practice is done. Umbilical cord, as we have discussed, should be cut with a sterile blade or scissor, and it should be cut at about 2.5 centimeter from the umbilical. It should not be neither very near nor it should be very far. 2.5 centimeter approximate distance from the skin surface. It should be tied with a cord tie or a cord clamp. I will show you in the next lecture cord clamp, how it looks like. And as I described previously, it should be left as such. It will dry up at its own and will shrivel up and fall within few days. You need not apply any medicine or antiseptic lotion on the cord stump. But the cord stump should be inspected daily. Why inspected? First is at birth it should be inspected. The cut surface which has been cut, it should have 3 vessels. Right? There are 3 vessels present in it. If one is less, sometimes in cases 2 are present, then the chances of a congenital abnormality in the child are higher. Secondly, daily you should inspect this surface for any oozing of blood. After delivery, now you have applied the umbilical catheter, but it becomes loose due to any reason, then blood will start oozing from it. Then you will need to reapply the umbilical cord clamp, right? So these are the main points for today's lecture. We will continue next time. Thank you.